Yes, Barb.
Hi, can I talk to you for a minute?
Yes, of course.
I have a concern. It's about Dr. Fassman. Quiggs?
Right.
He's a little different.
Is he? I haven't worked with him recently, but I'm starting ACS today and he's the senior resident. Anything in particular?
Well, the nurses, in fact, everybody on the ward thinks that he's been acting a little different.
Really? What way?
Well, he snaps at people, he is short with patients, and he forgets things. He doesn't answer pages, and he's normally really good and really supportive to the team and his residents. But now it's like working with a bear. We're concerned.
Thanks for letting me know about that. I'll look into it today and see what it's like. Right. I'll see you later at rounds.
Yep.
Okay, great. Then. Thank you.
Thanks. Quickly, before you get too busy on rounds, can you check on those 2 patients that need to go home?
Yeah, whatever. Just give me like 5 minutes. Yeah.
All right.
And quickly, I need to clarify the 2 questions for Mr. Babcock before he goes home.
Okay, you know, we're just starting rounds, so just
sure.
if we don't get to it, just pages or something, okay?
Jeez. I'll take Mrs. Flint for a jog and I'll let you know when she's ready.
Sure, great.
Hey, Quiggs, spare me a couple of pants at 9, okay?
Yeah. Savannah,
Yeah.
at 9, just make sure you're there. Get there and just get scrubbed in.
Okay.
Quiggs, let's get going.
Dr. Paul,
okay,
thanks.
you get your team together. Okay, I'll get this list down to Sharon and get it on the EMR, and I'll meet you on the ward in 10 minutes.
Definitely. Yeah.
Okay.
We'll be ready. For
Great.
Sure.
Good stuff. Don't be late.
Okay. Yes. Great. Okay, Savannah, Mel. Okay, we got a lot to do this morning. So we got a few admissions from last night.
Okay.
You know what? Some of these, we don't need to deal with this stuff. Like these patients can follow up the family doc, so I need to make sure you get downstairs, get those patients discharged, take care of your dictations, because I just don't want any of this stuff like rolling over, getting missed, falling through the cracks. Oh, and make sure that you get out of here post-call at a reasonable time. Like Dr. Bold really doesn't like it when residents are staying around, so just make sure you take care of that. Savannah, I really need to make sure that you follow up in the blood work for 3, 5, 4, 6. We should probably check out ICU, see that 1 patient from last night as well.
Sure.
So if you guys can get rolling, let's go, and let's get rounds taken care of.
Yeah. I just don't get why he's jaundiced. It doesn't really make sense to me.
Yeah. Mr. Heineken's jaundice is worse because of liver failure, not obstruction. He's optimised as much as possible, but he's too sick to go home. So, Quiggs, we're going to have to sort out a nursing home bed for him, please.
Yeah, this guy is just such a disaster. I mean, he is going to be here for weeks. You know what, Savannah? We just make sure you get in touch with social work. I mean, those guys, they just sort of hang around. You really need to bug them pretty regularly because anyway, talk to them, get it organized because we need to get this guy out of here.
Quiggs, you said that beds are scarce out there. Maybe we should just accept that and deal with it and work around it rather than getting frustrated by it. For one, I like having the social work team with us because they can make calls, they can find out what's available and move things along. So I think they're a really valuable members of the team.
Yeah. Okay. Sure. Yeah. Let's try that.
Okay. Who's next? Let's keep going.
So did we miss anybody on this ward? Savannah, you have notes on what to do for 1 bed 4, 3 bed 2, 7 bed 1, 8 bed
Sorry,
2.
Quiggs, I can't follow you. I prefer to refer to the patients by their names rather than numbers. For one, it's the only way I can remember who's who. Another thing, there is some recent literature that suggests that there's an erosion in the care we give patients when we start referring them as numbers rather than patients. And it's especially important when we're very busy, as we are on ACS.
Right. Okay. So Savannah, let's do that again. So do you notes on what to do for Mr. Heineken, Mr. Walker, Mrs. Guinness, Mr. Richard, Mrs. Miller, Mr. Jones, Mr. Sanderson. Good. Yeah. You got all that?
Mm-hmm.
So anyway, well.
Yeah, that's good. Hey, Quiggs, can I bring something up with you? If that's right, maybe a little bit of feedback.
Yeah, sure.
Okay. Well, we've worked together several times over the last few years, and I think I know you pretty well, and I've noticed these days you don't seem yourself, and others are noticing too. You seem very short with the residents and the clerks, you're rushing through things, you're occasionally missing things. Patients seem to be bothered sometimes, and I've seen you refer to the nurses and the other non-MDs as if they're the enemy. That's not your usual demeanour, it's not your usual high standard practice. I wonder if you notice these things as well.
Well, you know, the acute care surgery team is just so busy. We have a ton of patients, and just I don't know, there's so many things to follow up on. Blood work and vitals, organizing scans, disposition.
Yeah, things are certainly very busy on service right now, and perhaps we can look at the ways we can divvy up the work and get some more help to help out. But is there anything else?
Well, you know, to be honest, I've been pretty stressed out recently. I mean, the Royal College exam is coming up. I'm pretty stressed about that. The team is so busy. I just feel like I never have any time to study, and I don't know. Things are so busy. I barely get to see my kids. And you know what? My uncle, I mean, I'm really close with him. He was just diagnosed with locally advanced colon cancer, and he's a kidney transplant, and you know, things are just not going well.
Yeah, these are all really, really big concerns, Quiggs. It's hard to keep everything in balance when things seem to be crumbling around you.
Yeah.
You know, I'd really like to hear some more if you'd like to share some more. Why don't we make some time this afternoon after handover? We can sit down for a bit, and you know, perhaps there's some ways I can help.
You know what? Yeah, you know, that'd be really good, actually.
Good. Okay, I'll see you then.
Great.
Okay. Good.
Thanks.